With so much information swirling around about the COVID-19 vaccine, it's easy to get a headache. While we are equipped with a lot of solid information from reliable sources, misinformation is still very prevalent and it is having a dangerous impact. On top of that, the underlying mistrust of modern healthcare also sways people's vaccination decisions, especially marginalized groups. The National Association for the Advancement of Colored People and its partners conducted a survey and found that only 18% of the Black individuals interviewed would definitely get the vaccine. A large reason for this mistrust stems from a history of mistreatment of Black Americans in the healthcare system. One example of this mistreatment comes from the Tuskegee syphilis study that was conducted from 1932 to 1972. During this study, the United States Public Health Service promised 600 impoverished Black male sharecroppers free healthcare, some with syphilis and some without, but none of them were ever informed of their syphilis diagnosis and instead received placebos and ineffective treatments. This study went on for 40 years, and in that time, 28 patients had died directly from syphilis, 100 died from complications related to it, 40 of the patients' wives were infected with syphilis, and 19 children were born with congenital syphilis. As we can see, there is a long timeline of distrust in the healthcare system that directly impacts the stances people have on the public health issues today. And when looking at the COVID-19 vaccine in the United States population, it comes as no surprise that there is still a large portion of Americans who have not yet received the vaccine for one reason or another. But it's important to note that medical professionals were not starting from scratch when looking at the coronavirus. In fact, scientists have been studying coronaviruses for over 50 years, so they are very familiar with the structure and the life cycle of this kind of virus. The vaccine uses mRNA technology that has been used since the 1990s during the SARS and MERS outbreaks and helped create the groundwork for the COVID-19 vaccine. With this and the advancement of genomic sequencing, the viral sequence of SARS-CoV-2 was able to be uncovered quickly. There are currently 3 vaccinations being administered in the U.S., Johnson & Johnson, Pfizer, and Moderna. So far, 193 million have been fully vaccinated. That's 58% of the U.S. population. That means 42% of the population has not been vaccinated. The sad truth is that unvaccinated people are 29 times more likely to be hospitalized from COVID-19, and they are also 11 times more likely to die from it. Make sure you are making an informed decision and are getting multiple professional perspectives to help you make your decision on whether or not you should be receiving the COVID-19 vaccine. And you can visit the CDC website to learn more.